Hello, I am Mrs. Hina Gandhi. I'm one of the consultants in obstetrics and gynecology, one of the team of 14 consultants that we have at East Surrey Hospital, and I'm currently the Royal College tutor. Our structure consists of fellows and the junior grade doctors as well. So there are 6 middle grades and 10 junior grade doctors to provide services within the department. Our main hub where we all meet is the delivery suite at usually 8 o'clock in the morning, which is our handover time. The other working areas are the antenatal ward, the antenatal day unit, the postnatal ward, gynae ward, and the antenatal day unit and early pregnancy assessment unit.
My name is Balpreet and I'm an FY2 trainee, currently on obs and gynae rotation. Every day is different. We rotate around the different areas and departments in obs and gynae. So we may be covering theatres or labour ward, antenatal day unit, the gynaecology ward. We see patients in the gynaecology assessment unit and also the early pregnancy unit, and we get quite a breadth of experience just going through all those different areas. The day starts at 8 o'clock in the morning, so that's when you go to handover. Handovers for everyone, so it will be on labour ward, unless you're going to theatres. If you're going to theatres, then you'll usually go down to pre-assessment at 7:30 and see patients with the consultant who's going to be doing the procedures.
Usually all of us meet the consultant on call, the on-call trainees, and whoever is expected to work. We use that handover meeting as to share the information from the previous day's experience that the trainees have had, and if there are any interesting clinical scenarios apart from the board handover of the existing cases on the labour ward.
So it's quite a systematic and organized handover. Then the handover of the antenatal ward and postnatal ward and also outliers, and then the prioritizing and starting our morning day rounds.
Following that, we have the ward round, which starts from the delivery suite and then is extended further to the antenatal ward. There is a separate ward round that happens on the gynecological ward with the separate consultant, the EPAU and the GAU registrar, and the junior grade doctor takes over the role within that department. The postnatal ward doctor starts looking after the postnatal patients and planning their discharges and summaries. High risk clients there on the postnatal ward are reviewed by the middle grade or the senior consultants on duty.
The maximum priority place is the labour ward, which has to be covered by the registrar of our level, and then we get the clinics to do, which can come either in the morning or afternoon, antenatal clinics and gynae clinics, and we are placed in the theatres as well, where the consultants are very supportive.
The day duties start at 8 o'clock in the morning and the standard duties until 5 o'clock in the evening, unless they are on the long day, which finishes at 8 o'clock. The second handover happens at 8 p.m. in the evening when the night staff takes over, and we have a second round of handover of the day activities that has happened.
You'll either be gynecology on call or you'll be obstetric on call. So if you're on obstetrics on call, you'll be covering all the obstetric wards. So that includes antenatal day unit, postnatal ward, antenatal ward and labour ward. And you'll go to emergency caesarean sections or any other emergencies that might be occurring in theatre. If you're on gynecology on call, you'll be covering all the gynecology wards, and that includes the assessment unit and the early pregnancy unit as well.
The on-call, usually it is covering the labour ward when we are 12 hours on call, which starts at 8 a.m. till 8:30 p.m. So generally it is like it can be the full cover of the labour ward, or if we have enough registrar, then we are divided in the gynae and the clinics or the theatres.
The rota works separately for the middle grade and for the junior grade. So depending on the level of experience of the middle grade and the interest of the middle grade, we allocate their responsibilities during the daytime so as to maximize their opportunities of learning and the experience that they gain from our hospital.
It varies from during the week to the weekends. So during the week, if you're on call between the hours of 5 and 8. So there'll be an obstetric on call and a gynecology on call as well. So there'll be 2 SHOs and there'll be 1 registrar between those hours, and a consultant will also be present between those hours. At night time, so for nights, the consultant goes home at 10. So there's a consultant between 8 and 10, and then there's registrar cover throughout the night. So it'll be 1 SHO and 1 registrar throughout the night.
There are plenty of teaching and learning opportunities within the department. Here we have regular teaching sessions which happen on Tuesdays and Fridays for the middle grade and the junior grades. There are various multidisciplinary meetings that happen on Wednesday and Friday morning. There are plenty of opportunities of learning in theatres, and we all, as a consultant and the senior grade doctors, we do help supporting their workplace based assessment, so that it is important for their e-portfolio and their career progression.
We have teaching every Tuesday, and that's teaching done by one of the consultants. We also have teaching sessions on Fridays where we as the trainees present a certain topic to the rest of the trainees. And then we have our formal FY2 teaching as well.
We are involved in the audits as well with the quality improvement works in the hospital.
It's really good for learning how to manage different conditions. So when you're on antenatal day unit or gynecology assessment unit, you'll see patients from the beginning. So when they come in, you'll assess them, you'll take a history, do an examination, formulate a management plan. There's always a registrar who you can discuss the plan with. And we get a lot of support.
Yes, it is best in terms of gaining experience in the practical skills and as well as learning, and if you want to involve yourself to audits and research, this is the best time, because you get a lot of experienced person with you all the time and ask help, and you can do all these things.
There is someone who coordinates a leave, so you just fill out a form with your request in, and you can speak to them about it and any swaps that you might want to do, and they have a book that they put everything in so that it's all properly managed.
Before organizing our leave, we have to give a notice 6 weeks before. So it's like well maintained, and we are not in such a crisis that suddenly someone is off.
We have a thorough induction program on the day of starting, which includes giving you all the information about the understanding of the rota, the working expectations, my strict leave policy within the department so that nobody is disappointed, and information about the regular supervision that happens. I want all of you to enjoy your session, your placement in posting within the Obs and Gynae department.
The apps I use is the Royal College Green Top Guidelines, iPhone and Android, so those we use, and we have the hospital protocols as well which we use.
You've got loads of support around you, so from the midwives on the wards and the nurses on the wards, they're all very helpful, and they all know a lot about their patients and how to manage certain things.
Hello, my name's Mandy. I'm the ward manager on Brockham Gynae unit. We cover the gynecology ward, early pregnancy unit and gynae assessment unit. We're looking forward to you starting with us, and if you need any help during your induction period, please just find one of the nurses and we'll be happy to help you.
I have a very good relation with the midwives, and if we work together as a team, because our department is completely based on as a teamwork, so they are very helpful, very cooperative, and if I respect them, I get the respect from them. So it's like a teamwork, and I'm very happy to work with them as a team.
I think it's quite helpful to know that there's always someone to support you, because Obs and Gynae is a very different rotation to anything else that I've done previously. It's very specific, so you need to know specific things. Ladies who have come in and they're pregnant, just specific ways in which you would manage them, and the same with any gynecological cases. So it's just to know that you can discuss things with people, and that's okay.
Working in Obs and Gynae has got its own pros and cons. It is a very exciting place to work with, full of adrenaline, as you can imagine it to be. There are lots of opportunities to learn and to train if one is interested in doing so. Besides that, we have got middle grade and consultant presence up until 10 o'clock. So there is again continuous supervision all during the daytime available for them.
I think whoever is starting here will be very well supported by the consultant, because we really get good support from them, and we can gain our confidence to work with.
Yeah, it's very supportive. So everyone's really helpful, very supportive. All the registrars and consultants, and it's a really nice team to work with.
With all this information, I really look forward to seeing all of you in my department. Hopefully I have convinced you that Obs and Gynae is a good career for all of you.